that, we'll move into our weekly update report from our Public Health Director, Kathy McKay, and Jamie's with her today.
Good morning, Mr. Chair and Commissioners. Hopefully, the two commissioners that are remote have received the scanned copies of our numbers. Okay, so you can see from the first page, our positive cases continue to increase. We're at 3,233. Our 14-day case rate per 10,000 people, and that's at 105.57, so that has increased as well. The number of positive cases in Minnesota continues to climb, almost 185,000, and the cumulative positive rate for Minnesota is 5.7. So you can see as we look at the grid where there's confirmed cases, no longer needing isolation, and active cases. We're at 655 active cases right now as of November 4th. Our age categories, when you look at the ages in Clay County cases, the highest age ranges currently is that 18 to 22. And we're also seeing pretty significant numbers in the ages 30 to 39. So those are our two high points for the ages for Clay County cases. And then on the back page of the stapled one, we're seeing the Cass County numbers that we've reported the last couple weeks. So they're at almost 12,000 cases, 1,542 active cases. Their cumulative positivity rate is 16.99, so that's pretty significant. Their 14-day case rate per 10,000 is also quite high at 123.9 from up through October 26th, and then the number through 26th through the 8th of November is 165.88. So their positivity rate continues to climb, and they are certainly one of the highest states with those rates and the positivity rate. And you have all received the letter from Commissioner Malcolm, and they sent this out to about 42 counties that are over that 5%. We expected our rates would increase. I've talked about it at numerous meetings that we are going to see increases. We have the saliva testing site, so we're doing a lot more testing. So that contributes to the increase in our positivity rates, of course, because we're seeing a percentage of increases in the more we test, the more we see. The overall positivity rate for Minnesota is 5.7. Now, the Clay County number, as we don't often talk about, the latest number was, let's see, our latest number is 7.4. And I've described this before, where we do not receive all of the negative tests from the North Dakota Public Health Lab. So it isn't exactly accurate. It's around that rate, but without those negative tests, we're not really seeing an accurate positivity rate. That's just the reality of being on the border. In Clay County, so what they capture across the state is just the positivity rate based on the lab tests they have. So it's been, in Clay County, it's been in the sixes, like 6.2, 6.5 this last month. And now we've increased a little bit to that 7.4. So we're, again, in a group of many counties across the state of Minnesota, as well as the state overall being higher than 5%. The state has been around in that 5.3, 5.7% positivity rate.
Personally, I think we're probably even higher than that. I mean, all over the state, because
Correct.
I'm just talking about from a family situation right now this past couple of weeks. I mean, if you don't know you have it, I mean, my son tested positive, but he had no symptoms at all. So there's all kinds of people out there, I think, that have this. If you don't get tested, you don't get counted.
Correct.
But because he tested, he gets counted. I mean, and I think there's a lot of people, they don't have no symptoms, but they do test positive.
That's
And
correct.
I think, so we're even higher than these figures. It's out there, and I think it's spreading. We gotta be careful. Masks on.
You're absolutely right on. It's out there, it's spreading, it will continue to spread, and you're also right on about numbers of, there's so many asymptomatic people or very mild symptoms that it's just not even enough to go get tested sometimes. So, some people have minimum symptoms, some people have a little bit more. It's such a variance. The younger group of people have less symptoms or less severe symptoms. So, we worry about the ones with the more chronic health conditions, those that are more predisposed to having adverse effects from this, as well as the elderly. They don't have quite the immune system to fight it off. So it's a concern. So I'll let Jamie talk a little bit about some of our testing and other things.
Okay, well, I'll start with the saliva testing. This last week, the week of November 1st, there were 3,433 people that went through the saliva testing site. And it's pretty much an even split between Minnesota and North Dakota. So we are continuing to serve North Dakota residents as well. Of those, 22.18% were positive. And so we're continuing to see an average of 20% of the people coming through that testing site are positive, which is high, And
Yes.
so that means we are catching the positive, so we're able to respond and get them to isolate and contact reach out to their contacts for quarantine as well. And so that was about 1,000 more than we tested the week before, so we're increasing the number of people testing by about 1,000. Initially, when they started, they told us that they had the capacity to test 800 to 1,000 individuals a day. So they've got plenty of opportunity for testing. And the comments that we're hearing about testing is that it's going really well, that people can register online. We've had people that if they don't have a computer and they can't do that, they can walk in. It sounds like they're doing a great job of serving walk-ins and appointments fairly, so people aren't standing in that line waiting to get in if they've not already scheduled an appointment. So it continues to go well, and we've heard a lot of positive feedback from the community and having that as a resource. Are you going to say something?
No?
No, okay. And then I'm just going to highlight a few things that were discussed yesterday. The Commissioner of Health, Jan Malcolm, and the Governor had a press conference, as they do, every week, and a lot of comments came out of that. But basically, if you haven't heard, the Governor's talking about an announcement this afternoon. There's a lot of discussion about what that will involve. But basically, the Governor was saying that we have Minnesota Department of Health is seeing 3 infection sources: social events such as weddings, funerals, and large family gatherings, and bars and restaurants. And so, again, keep stressing the fact that it's social gatherings where people feel safer with their own family and friends, so they're not wearing masks, and those are the areas where we're seeing the spread, which is spilling over into our workplaces and our schools and our universities and long-term care. So some of the Governor's comments were that the top 5 states for spreading the infection included North Dakota, our neighbor, and Minnesota is estimated to move into the top 10 very soon if we don't make some changes in Minnesota. Active cases in Minnesota have tripled over the last couple of weeks, and the average daily positivity rate is poised to hit an all-time high by the end of the week, averaging 15% daily positive rate for November 11th. If we don't make some massive changes quickly, we will see higher cases and deaths. Commissioner Malcolm talked a little bit about that silent asymptomatic spread. And it's unusual when it comes to viruses. Usually we know when someone has a cold and we can kind of keep our distance from them. But in this case, the asymptomatic spread is what's causing a lot of challenge for us with COVID. They kind of talked about the silent spreaders being the 18 to 35-year-olds. And they really want to focus hard on getting those that are the silent spreaders, the asymptomatic positives, to be tested so that we know they're positive and we can respond to that quickly in order to isolate and quarantine to be able to control the spread. You know, we've heard about super spreaders, and she said transmission is not just from a couple super spreaders, it's from thousands of mini events. Again, really stressing the fact that it is those small gatherings of family and friends is where we're seeing that spread. And then the governor also talked about vaccine distribution and the plan coming for vaccine distribution as being a massive undertaking. I've mentioned before, there's a lot of work from the federal, the state, and the local level to prepare for vaccine administration. And just it's coming soon, and we're hoping that we will start to vaccinate healthcare individuals and the most vulnerable populations in our communities. So those were the highlights from yesterday's press conference.
Just from a personal experience, what I went through with the testing, you know, I think I would have liked some sort of sheet or told me what to do. I mean, because when you get tested till you get your results, I mean, you really don't know what to do, you know. I mean, are you quarantined? Aren't you? You don't know whether you have it or not. So there's some sort of precautions that we should be taking, I think, you know, if we're not quite sure or something, you know, because it took us almost a week to hear from our provider, you know, and stuff, before they finally, we said, okay, you tested positive, you contacted your provider, they returned your call. I mean, it was almost a week later, you know, so had we not taken precautions, we could have made a lot of contact. And I don't know whether we should be given a sheet out saying, you know, do this until you hear from your results, do this, you know, stay quarantined or something like that. I don't know if they,
you know,
it just seemed like we were just left out in limbo for a week.
I know Vault, when they came and set up, they said they were very, they wanted to be paper-free so that they would not have that. And I know I personally tested as well at that site, and I went through things kind of quickly because of what I know. So I'm not sure how much information was in there in terms of the directions, if it told me what to do until I got my results. But I do want to tell you that people call us all the time, all day long, and that's what we help them with.
Good.
Like the DGF school district actually literally has our phone number and our names on their website and the information that goes out. But also our universities and our K-12 school systems are doing a lot of that themselves. And I can't stress that enough. They are doing all of the case investigations in-house. We get phone calls from them regularly. What do you think about this as well? But a lot of it is being done at the business level. I had a business owner who called to say, okay, this is what I'm doing. So they will often run by us. This is what I think I need to do. Is this correct? And so we just really want to encourage people, if you've been tested, stay home. If you're not sure exactly what it means beyond that, to call us, because we're happy to answer those questions.
Yeah, okay, good. I'm glad to hear that, because, I mean, it's serious. And it's getting worse.
Yes.
And it's just, go ahead.
Yeah, one of the catch-22s in this thing is that there's a lot of people who, you know, as you just mentioned, when you go to get tested, then you're basically quarantining at the same time. So there's a lot of people who don't think they're have COVID, and they don't want to go get tested because they'll be quarantined and not be able to work.
Right.
Yes.
And it's a real dilemma. And I don't know how we can figure that out, but and it goes to what Frank said. You might not know you have it, and you go and you find out you do. But then, as you also said, we had, I think, based on your number, we probably had 1,700 people tested last week. Yeah. In Morehead here of Clay County residents. And of those 1,700, if the 20% are right, that'd be 350 people ended up being positive. But that also means that there was 1,300 and some that weren't. And those 1,300 and some still ended up being quarantined. And so you can see the problem that creates from those who depend on paychecks from week to week. Yeah, so I don't know how we fix this.
Right.
I just don't know how we fix it.
And you're right about that challenge. That's hard because people don't want to and have a hardship if they have to quarantine. So we know that there's people out there that aren't going to get tested, or if they do, may not say anything and go to work or school.
So
that
of
is-
those 1,300 that did not test positive, are they immediately released from quarantine then, or do they still have to stay on that 10-day quarantine?
The exception to that would be if they just decided they wanted to see if they were an asymptomatic spreader. So they had no known contact
No-
and
no-
no symptoms.
Okay, then they would be released.
Yes.
Correct.
And they're told that then?
Well,
We tell them that. I'm not sure if
No,
the,
that's where I thought what the problem
Yeah.
was. You didn't get that information.
okay.
okay.
So that's a gap then.
I mean, we went through the tests, we left, goodbye, you know, and, I mean, I'm glad they're testing, that's
Right.
good. It just felt like we were left in limbo. Okay, now what do? We got tested, now we don't know our results. Do we have it? Do we don't have it? Are we quarantined? Where are we? You know, it just seemed like there was something missing there, you know, and it's just, like I say, even after we heard we were positive, we still waited a couple more days to hear from our providers.
Oh,
For
okay.
them to return. I mean, that's got nothing to do with the testing, but, that has to do with the providers, but, it's so easy to spread it. I mean, it's just, if you're not careful.
Right.
And that's why I'm just saying, we just gotta we consider ourselves that we have it. Be careful.
We do have the information, you know, we put it out on Facebook, we also put it out on our website, so, you know, that some people are receiving it that way. I did want to say, Jamie mentioned, you know, K-12 and higher ed and the great job they're doing. We are working with both of, all the superintendents in K-12, making some hard decisions about, you know, the school and what they're going to be doing, as well as higher ed. Now, higher ed has made some decisions about when they're going to go remote and the break that they're going to have between the holidays, Thanksgiving and Christmas. So they're making some really tough decisions now about, you know, having to have a longer time period where the students won't be in-house and they'll be doing their classroom remote. As we see the numbers go up, they're just, it's time to make some of those tougher decisions, so.
And personally, I think you people are putting a lot of stuff out there, and that's good. It's just that we're not reading it sometimes, you know? It's there, but we're
Oh, I
not
agree.
reading.
There's a lot of information, and
Yeah.
that's very true.
So I'm not trying to put the blame on anybody.
Nope, we
It's my
totally understand.
responsibility to find out about it too.
Mm-hmm,
So don't just sit back and say, well, no one told me about it, you know?
yeah,
Boy, we haven't heard about it by now. Wake
Yeah.
up, people.
yeah.
Okay.
Well, thank you.
Okay, any other questions for? Okay. Thank you
Okay,
very much for
thank
the
you.
update and keep up the good work.
Thank you.